Welcome to the Rotary Time Show, a public service program presented by the Rotary District 7610. Funding for this program is made possible by the generosity of Rotary District 7610, Virginia. On our program, we speak with Rotarians and community leaders to discuss how Rotary International builds partnerships to support local, national, and world communities. I am your host, D.G. Paparowski from District 7610, Virginia. Many Rotary clubs in District 7610 are known in their communities for their one big project or event. Over time, the projects and events have become signature efforts and have helped to better serve the diverse communities in our districts. On today's show, we will hear from two clubs about their signature projects. Welcome Rotarian Carl Braun, who is joining us remotely from the Rotary Club of Mathews. Hi, Carl, how are you? I'm so glad you could be with us.
Well, thanks for having me on, Pat. It's good to be here. Good to be with you.
Yes, and I want to say congratulations on a terrific, Carl is the immediate past president of the club, and you had really given everything. You had a wonderful year, accomplished a lot, and we're going to talk about one of those projects. So just very quickly for our audience, give a little background about Carl and your journey to Rotary.
Sure, Pat, thank you. It's been truly a career based upon healthcare. I've had the opportunity to be with a number of companies through acquisitions within the medical device, capital equipment, implantables, but also pharmaceutical industry. I've always appreciated the opportunity to be engaged in healthcare in order to help others around rare diseases, ophthalmology,
Sure.
MS, also rare blood diseases, but most importantly and recently glaucoma, which really has led us to the baseline of what created the district grant project that we put together. So, and running North America for Pfizer Corporation, I had the opportunity in their specialty division to work with churches and others in regards to bringing tests an opportunity to help bring better health to those in the community.
Well, that is a wonderful background and really leads us in. Why don't you give the audience a small snippet of the project and then we can kind of break it down.
Love to, Pat. It's been a fun project, as I mentioned, based upon what we worked with in the glaucoma screening. And it's about healthcare, bringing it to a local level to those who need it, educating and finding an opportunity to offer prevention before things get too serious. Here in Mathews County, we have about 10% of our population is eligible for Medicaid. Oftentimes, though, they try to get in and they're working and they make a little bit of money and they don't longer qualify. What we found is it's important that we offer health screening to those who need the help, whether financially able to pay or not. So the key indicators that we looked for were first A1C for basically diabetes and cardiovascular disease with BMI and also blood pressure. So we wanted to focus on those for the entire community of Mathews County and offer a health screening so we could get those people that might be prone to it, get them treated early, and get the treatment they needed through the healthcare professionals of Gloucester Mathews Care Clinic.
That's wonderful, Carl. Now you have done that with both Rotary partner and with community partners. Speak about those two groups.
Sure. We were able to partner with our sister Rotary Club in Gloucester. Gloucester took their district grant in working with the Gloucester Mathews Care Clinic as well, identified a need that they had in being able to have a portable A1C testing equipment.
Oh, wow, yeah.
They utilized their testing equipment to purchase, they used their grant to purchase the equipment that we were able to use in the screenings. It's portable, it provides an input easily, and the output comes out 10 minutes later. So we're able to quickly identify if there is a diabetes situation. And it doesn't just measure at that moment, it measures over a 3-month period of time, which gives us a very accurate reading. So working very closely with the Gloucester Club in supplying the equipment with their grant, identifying the needs with Gloucester Mathews Care Clinic, and then us putting together the screening to utilize the equipment. Really, all three of us worked in concert in serving the people in our community.
And that really is not only a cooperative partnership, but a wonderful example of a collaborative partnership where you're really bringing needed elements to a single project as equal partners, really. And then how did you go out in the community with this?
Great question. We worked very closely with the Gloucester Mathews Care Clinic in identifying the proper population that they felt was really in need based upon their years of service to the community. Mm-hmm. We first went and worked and coordinated with churches in the area. We identified churches geographically around the Mathews County and found that many of them were open to helping their congregations and friends of the congregation come to the health screening. So we set up our first screening, Pat, and had announcements go out via Facebook, through our direct mail campaign, but also through the church and church elders. Mm-hmm. We set it up on a Thursday afternoon and evening, and we were ready to go with a staff of 8 people there, both healthcare professionals, doctors, and as well as Rotarians. Unfortunately, we were the only ones that came to that health screening.
Oh, wow.
So I think one of the things that we quickly learned is being a little more adaptive mm-hmm. in regards to what we're going to do next time.
Mm-hmm. Yeah, and that's, I think, a wonderful example of lessons learned, and the fact that you were open to adapting the program. And again, I think that's an example of the collaboration, because everybody learned, everybody knew what you had to redo. What are some of the highlights for you and the club in terms of A, having done this program in the community, and then B, how it helped the people in the club, the kind of joy that it brings you?
Boy, that's a great question. I think one of the things that we found is we really wanted to help serve the community, so we came back and met with others in the community as Rotarians went out and asked other churches as well as other civic groups where people of need might be. And I think what happened was we found a great spirit out there that others had done similar programs and felt that weekends, which we originally had targeted, but also public options where there's a number of people around that would be walking by and be able to identify that the test was only 15, 20 minutes. But what really brought us, as you say, the warmth and gratification of serving the community was 2 patients in particular that were were guided by fellow Rotarians to the health clinic, because these Rotarians were aware that they had health needs, but right. couldn't take the time, nor did they have the transportation to get to the screening. We were able to do the screenings for both diabetes and cardiovascular, and we were excited to find out that they were in good health. But with COVID, as well mm-hmm. as the challenges sometimes of some of our fellow citizens out there not being able to go into town, public transportation not only available for them, right. Being able to drive them there, and also have this health check be there for them. I think everybody felt that success, and then others by holding it at a more of a community setting on the weekend, that we found the solution by working together with civic groups, churches, as well as going out and just sometimes asking the simple question, right. where do you think these people are and how can we best serve them? And then having the success of being able to screen people and bring them there and find out their health is okay, but having them know there is a place they can go to get the help they need in the future, if need be.
You describe such a wonderful, multi-layered exploration, if you will. First of all, you learned a lot about your community, a lot more than you knew when you started the project. And that will be certainly helpful in other projects that you do with the community. Sometimes we overlook the issue of many people do not have transportation readily available to them. And so how do we provide for that? And being able to work as a community of Rotary clubs, that's got to be a highlight. That brings the brand of people in action to the fore and showing people in your community.
And Pat, you bring up a really great point that we learned is local knowledge and local customs. What we found out is that oftentimes that people are uncomfortable being in a clinic setting, not knowing how long it's going to be. Is this a half hour? Is it going to be exposed to other? Will my health care be seen there? Do I really want to be affiliated with certain groups and getting my health care exposed? So we've learned a lot in trying to make it an open affair. It was educationally based now as opposed to just a screening. And that also brought people in. A healthy snack seems to help as well. But understanding a local community and its needs, asking those questions, not letting the first screening slow us down, but continue to evolve. So we're very excited. At our last screening, we had over 15 people attend, which we felt was a great success for a community of our size.
Well, thank you very much, Carl. This is going to be wonderful for the other clubs. As you know, we're putting a repository of our club's significant projects together that'll repose on the district website so that other clubs can learn about this, your process, adopt it in their community. And I just want to say to all the Rotarians in the Mathews and Gloucester area, thank you so much. And we're going to take a short break now and be right back and learn more about District 7610 Club's signature projects. Thank you.
We are this close.
We're this close.
We are this close.
Of wanting
to making history.
This close to changing the world.
We are this close.
This close. This close to making sure no child suffers a crippling disease
ever again. This close.
We are this close to ending polio.
Ending polio.
All we need is you.
This close.
If we don't act now, we may lose this chance forever. Help Rotary make history at endpolionow.org.
Welcome back to the Rotary Times Show. We are here with a member of the Rotary Club of West Springfield, Virginia, to learn about another club signature project in District 7610. We welcome Rotarian Kyle Beckman to the Rotary Times Show. Welcome, Kyle. Thank you so much for being with our program.
Thank you for having me, and thank you for allowing us to highlight our event and talk a little bit about it with the district. Thank you.
Yes, absolutely. But before we get to that, just quickly, give us a little bit about Carl's journey to Rotary and your position in the club, one of the passionate projects that you're involved in.
So I like to tell people I'm a relatively recent member of Rotary, but a longtime beneficiary. So I joined Rotary about 3.5, maybe 4 years ago now. I had been working with a nonprofit that was dedicated to fighting trafficking, human trafficking in Northern Virginia, specifically juvenile trafficking. And that was one of the causes that Rotary supported. Right. And I was so impressed with the support and the dedication of the Rotary members from West Springfield that I decided to join the club. But that wasn't my first experience with Rotary. My first experience of Rotary was actually way back in high school, when I went on a trip for YMCA Youth in Government, and the Rotary Club of Burnsville, Minnesota sponsored my trip. So I've been a longtime fan of Rotary.
Wow. Oh, that's wonderful. I'm so glad that you've come back as well. We got to do more capturing of those high school and college students.
Absolutely.
So let's get right to it. Give us a little capsule of what your project is.
So our project is called Eagle Challenge, and it's a virtual race. Last summer, summer, during the height of the COVID crisis, we were talking amongst ourselves in the Club of West Springfield about how we could make a difference and also how we could, show the community that Rotary was involved. And we knew we couldn't do anything in person with the lockdown and the restrictions. So a friend of, a club member's son had been running these virtual long distance runs. So we started to talk to him about that. And that didn't really seem the right fit for our community, but we thought if we made it a more relaxed virtual event, that might be a good fit. So last year's event was a virtual run, walk, and then some folks said they'd like to bike. So then it became a virtual run, walk, bike. And then some others said they wanted to swim. So it became a virtual run, walk, bike, swim. And we had about 150 people participating from the local area, but also from all around the world. We had a lot of fun, and we raised over $7,500 for 3 local charities that were helping out families in need during the pandemic.
Right, and I can attest, it is fun. My husband and I were part of the D team last year, and we really enjoyed it. And talk a little bit about the projects that the fundraising goes to, and then we'll get back to the specifics about the Eagle Challenge.
So we wanted to pick organizations that we knew and that we knew, we could trust and that would be good stewards of the money that we raise. So the Rotary Club of West Springfield has worked with an organization called ECHO here in Springfield that provides emergency food and clothing, school supplies, some emergency assistance, and helps residents who are struggling link up with county services. So we knew that they had, a huge spike in demand with COVID, and that their traditional fundraiser, which is a big yard sale at a local church, had been put on hold. So, they had increased demand with reduced supply, so they could really use our help. We've also worked for years with the Lorton Community Action Center, down a little bit south of us, and we do projects through them to provide backpacks for children who otherwise wouldn't have school supplies. We provide Thanksgiving meals for some of the troops at Fort Belvoir who, really aren't paid enough to live in an area that's expensive. And then the third organization we helped is something called So Others Might Eat in downtown Washington, D.C., which is a charity that my family and I have worked with for many years. It's a well-known and well-respected organization that starts out by giving needy people in D.C. a meal. They serve almost 1,000 meals a day, but then they use those meals to bring these people into job training programs. They have affordable housing programs. They provide health care, counseling. It's a wonderful organization, and we were happy to support them as well.
And so you're repeating the Eagle Challenge. Tell us a little bit more about the mechanics of the Eagle Challenge and how virtual fundraising in this context operates.
So I'll take both parts of that in turn. The first part, I wanted to highlight that we are doing it again this year. We made some changes for 2021. We immediately found that people liked the flexibility of being able to do different things. So as I mentioned, we had 4 events, and the second person who signed up said they wanted to kayak instead. So for this year's event, we've opened it up to all physical activity, from line dancing to weightlifting to competitive into high intensity yoga. Sorry, that was the tagline that came off much better when I said it smoothly. But what we're asking people to do is they're going to report how many minutes they've done each day for 15 days from June 15th to June 30th. And then at the midpoint, we'll post who's in the lead with how many minutes. People can participate either individually or with teams of friends, family from across the world, and we will recognize our leaders. And then on the 3rd of July, we'll have a video conference where we'll recognize the winners in each category.
Now, I'm sorry, I was just going to say, last year, how did everybody do? Who were your lead people?
Well, without patting myself on the back too much, I was the lead biker for men in my category. We had some of the youth who participated. We must have had some serious swim team participants, because we had a young lady who swam more in the 2 weeks that we ran last event than I would swim in 2 years. Something like 15,000 yards or some, insane amount. But the big winner, one of our Rotary Club members, is friends with a U.S. national team. I think it's women's lacrosse, but it could be something else. But he has contacts there, so that whole team joined and they ran together, and they ran 500-600 miles. That team just racked up the miles. But it was a lot of fun for everybody, and as far as the mechanics, we used Eventbrite to sign people up because that takes care of the donation, handling all the money, so we don't have to accept money. And then we just use some spreadsheets to keep track of everyone's mileage, and we'll announce the winners on a Zoom call like this, I think.
Now, a couple of things that you identified is you're able to bring people beyond just your local community, number one. And number two, people in your local community can reach out and get more people involved. And so do you think that there's going to be a place for virtual events like this going forward, even though everybody is going to start returning to kind of what they did before?
I do think so. As we talked about in the preparations for this interview, this year has been more challenging than last year. I think that part of it is the timing, that as the world opens back up, people are a little bit less interested in virtual events. But I don't think they're going to forget about the power of the virtual event. And I think that once people, get a little bit of the stir craziness burned off, doing things in person, that there will be a desire. I've actually seen my family members more the past year than any year since I joined the Navy 30 years ago, because we could do a Zoom call on every holiday and everyone was there. We would just get together on weekends. So I think people will remember the power of this virtual event. And I think that one of the fun things about last year was that we did have the participants from all over the world. Everyone could do it at their same pace. We're talking about maybe doing a hybrid event in the future where we have a virtual portion, and then on the big day we have an in-person 5K race along with the drawing. That's a little bit more difficult to manage, but that would allow us to please the people who want that in-person experience as well.
And absolutely, just as we're going to have to manage that with our meetings, we need to be looking how we can integrate that kind of hybrid experience within our fundraising as well. You bring up the point of we've all been on Zooms with our families, and in an odd way, as you indicate, your evidence of it, we actually saw more of them than we do normally in the year. And it is nice to have those shared experiences. We certainly included some of our son in LA was running with us last year when we were involved in your program, and we're signed up again for this year. So we love it. It's lots of fun. What would be like the lessons learned that you would tell clubs if they were looking into this?
So one of the things we struggled with a little bit last year was we kind of over-engineered it. I think we made it a little bit too complicated. We tried to give out medals and wristbands, and we had too many different categories, and the overhead was more than we really needed, which is why we simplified it this year. So, the old rule, keep it simple, applies to this as well as anything else. And then, make it fun. So look for opportunities to highlight things on social media, find ways to, bring families and friends together so that everyone has a good time. And I think that's what people liked best about last year's event, and what we're looking forward to with this year's.
Absolutely, because I know one of the fun things for us was being able to post on Facebook, and I would see Steve and Marla doing things and their son, and then of course our fellow Rotarian JJ in Australia. And it was great, and it was a way of really being together and doing something hopeful during a time that very few of us had any kind of control. Would clubs be able to contact you for your advice and guidance if they were looking at things of this nature?
Absolutely. I'd be happy to talk to clubs from across the district or pretty much anywhere about, what went well, what was challenging, and, what I would recommend going forward. I'm sure that if they contact you, you can give them my email address, and I'd be happy to talk to them.
Well, absolutely I will. And we will be looking at a virtual event additionally in this district coming up, and we'll have more information about that at a later date. But Kyle, thank you so much for being with us. First of all, I want to thank all the members of the Rotary Club of West Springfield for everything that you do in your community. You are a very active club and you're very meaningful to your community. And secondly, thank everybody for choosing Rotary and being in this district. The world is a better place when we all work together for the benefit of others. So thank you very much. Thank you for being with us. And we will make sure that they're going to contact you.
Thank you very much for having me, and I look forward to seeing your virtual results from our event, which starts tomorrow.
Yes, absolutely. Bye-bye.
Bye-bye.
Funding for this program is made possible by the generosity of Rotary District 7610, Virginia. From the Rotary Times program, I am your host, 7610 D.G. Paparowski from the Rotary Club of Bailey's Crossroads, Virginia. You are welcome to join us at a Rotary Club in your area for breakfast, lunch, dinner, or even a service project. You can find a club near you by looking us up on the internet. Many clubs are hosting meetings virtually or in some form of hybrid format. You only need to look us up to see the details. Remember, our time is your time, and together it is time well spent. Please join us for our next program as we continue to celebrate Rotary's 116 years of doing good in the world through service above self.